Hi, my name is Anthony. So I'll be presenting my practice of change for Snug 202. So the first slide that you're seeing is the came from Australian asthma statistics 2017 to 18. Um, as you can see, there's a lot of people dying from asthma. So that's one in 9 Australians are affected by asthma. That's equivalent to the total population. So 11.2 or 2.7 million people are suffering from, Australians are suffering from asthma. So, according to the statistics, there's a higher chance of mortality to people who are living on remote areas, um, people living in lower socio-economic status, and indigenous Australians, which is according to the statistics very high. So there's a higher chance of contacting the or dying from that disease. So 2018 there are 389 people that died, and 80% of those could have been prevented. So just give it a number. So 152 died from New South Wales, 89 from Victoria, 77 Queensland, 34 South Australia, and 19 from Western Australia. So according from their statistics, so those who left the hospital, so they were given asthma action plan to manage their asthma. However, only 28.4 of people have an action asthma plan, and it's just really low. And then from those 28, so for 0 to 14 years old, they follow through with it 50%, maybe simply because they have parents, while the rest are 21.8 because some of them are old and they believe that their asthma will go away. So in my proposed change for asthma practice, one is self-management with education. According to Pete, a research, according to his report, which he done, it's an old article, stated that the burden of illness due to asthma is high and increasing. This is due to the delivery system. So it's affecting the patient because some of them were not taught on how to manage asthma, or or some of them have you know limited knowledge about it, poor asthma management skills, especially when the asthma attack is severe. This is due to lack of education. And then when patients goes to see their GP or the doctor, they ask for a corticosteroid shot. So according to Pete, that's reason why even though we have these strategies, asthma management's not working. So in my uh, research, I found two authors. One is Gibson and his colleagues, and one came from Hanane's group. So Gibson's group used a randomized controlled trials for um, for adults above 16 years old and was diagnosed with asthma by their GP. In their trials, they split the group into two. So some of them, the first half received a further education on how to manage their asthma. So that includes information about their asthma, such as written, verbal, audio, and visual, and instruction on how to use the peak expiratory flow and how to record it. And they were told to um, uh, get a review from their doctor and consult. to consult their action plan. While the other group, they were educated, but um, they they did not specify on how they would manage their asthma. Plus, they were just given a leaflet on how about their condition. So at the end of their trial, the group that was given instruction or further educate given further education about their asthma uh, scored well compared to those who did not receive the education. So therefore Gibson and his group concluded that it's better to somehow teach the patient self-management and give them education on how to treat or how to manage their asthma. So another study was done. So this was with Hanane's group. So they explored care pathways for adults with asthma. Uh, um, they did a random. They did similar thing, but it's more of an interview. Uh, and, and according to them, the reason why patients perform poorly on their self management simply because some of them don't trust their physicians. They have certain beliefs. Um, they think that their GPs or whoever's treating them doesn't have enough time for them, or they think that they're misdiagnosed. So when Hanane decided to ask them on how the their GP, doctors, or whoever's treating them on their asthma, or they asked their patients or their participants. According to their participants, they would love to somehow collaborate with their doctors. Um, of course, somehow um, they were asking for more information about on how to manage the asthma. Um, that means further education, so reviews. Um, According to them, the treatment should become more personalized. So my next proposal uh, for change practice um, is the asthma action plan becoming more personalized. In the statistic that was shown, only 28% of those patients that came from the hospital there's only like 28% of them receive an action plan, and in in adults from 15 and above, only 21% of them just follows it. So that means the action plan is, I guess, generic. And according to Matheson, the action plan in the community setting is either a few of them or none of them use it. So it's very low. So therefore, I opted to use a more personalized approach. And according to the research done by Powell and Gibson, Villaruel and her group, um, Mayux and his group, according to them, the more personalized approach works for patients. It's for for asthma patients, at, simply because it's more they thought that this is more for them, or the the GP or the health professionals involved in there really cares for them. So in the research or in the trials that was done by Powell and Gibson, Villaruel and Mayux and his group, it is shown that the more personalized asthma action plan have shown or somehow help, or patient have shown significant um, improvement with their health in terms of managing asthma. Therefore, if we apply it on a hospital setting, the statistic might there will be an improvement. So we, in my proposal, so like the action plan, if we give action plan, we should somehow we should tell the it will be it that it needs to be more um, person-centered care. So, and I guess if we practice it, if we become knowledgeable on how to provide a more personalized action plan, the better we become on giving it. So, learn a new practice. Of course, there'll be barriers. So, I have identified three barriers when implementing the new practice. So, one is difficulty in changing the practice model. One is lack of trust in the evidence and research, and the other one is resistance and criticism from colleagues. It's very hard unlearning a practice, and it's hard unlearning a new one. Um, to sum it up, um, nurses, uh, GPs or doctors, in their years of experience, have developed a system on which they can somehow um, the um, make the guideline fit the patient's condition or every scenario. So with this new change, it'll be hard to unlearn those practice, and whatever experience they um, gain from their practice, well, they have to make new experiences. So therefore, sorry, it's normal since this that the practice that I'm proposing is new, um, doesn't have a lot of evidence. Well, because it's new, and of course, um, it's normal that there are people who be resistive of the change. Um, to overcome these barriers, the research done by Spalek and his group um, somehow identify three things so to facilitate the change, and I believe that this will help the transition from old practice to new one. So one is, I guess, helping the health professionals on overcoming their fear of change. Um, I guess it's more of motivating them. So it's on the management side. So management or the organization will have to help the nurses, the GPs or doctors or whoever health professional that treats asthma. Second is if there are um, if there are any difficulties on implementing the new practice, um, they should somehow recommend the change. And then lastly is get more evidence. Consider more evidence-based practice. I guess this would be on the GP um, or GP nurses or health professionals to somehow try to practice more or gaining more experience so that because the practice is just a guideline. So the ones that I propose are just guidelines. So each the guy so the whoever is helping the asthma patients will have to somehow think on how how they would give it to the patient. So yeah, so that's my report for Snug 2. Um, uh, thank you very much.